So, I'm getting back into the swing of things after having been sick for a little bit. Forgive my voice for being a little off. I thought I'd start us out with a study that I thought was one of the more interesting studies I've seen recently. This notion that humans will trade pain for useless information. Participants chose physical pain over the pain of not knowing, and this has a number of implications for medicine. In previous studies, people were willing to invest small amounts of money and exert physical effort in order to learn the outcome of predetermined lotteries. And these were situations in which the knowledge could not affect the outcome at all. And so the researcher got curious and wondered, how far would people go, right? And so he showed participants a series of coin flips, but the participants weren't told which side came with which prize. And then he offered them a choice. Rather than waiting, they could immediately learn the payouts of the different sides in exchange for receiving a brief, painful flash of heat to their forearm. This knowledge had no effect on the outcome of the coin flip, which was random. Participants would earn the same amount of money regardless of whether they knew the values ahead of time. In nearly half the trials, participants accepted even the most severe level of pain. This willingness to endure pain in order to gain non-instrumental information may stem from a deep-seated aversion to uncertainty, to the point that some people are willing to go through physical discomfort for a few scraps of solid information. Not knowing is really painful. This is such an interesting idea to me because people value the information even if they can't use it to change the outcome. In medicine, oftentimes people will want to know information that not only cannot help them, but even could potentially harm them. I did a video before, which I'll link in the description below, on full body MRIs, and there's this notion that, you might have cancer growing somewhere in your body, and wouldn't you want to know? But number one, it could be a false positive, but number two, even if it is there, it's not entirely clear that we should do anything about it. Maybe your body's going to take care of it. Maybe we don't have any treatments for that particular type of cancer that are effective. And so it's not clear that there's anything that needs to be done, but people nonetheless want to know. There's this desire to know things, even if it turns out not to be useful, even if it turns out not to be beneficial, even if it turns out to be harmful. Nonetheless, people still want to know. In the era after COVID, we got used to testing for COVID, but now, I just got over a cold, and so many people have asked me, did you test for COVID? Did you test for the flu? Did you test for other viruses? Did you take your temperature? And my question is, what would knowing do? What would I do differently if I knew that it was one virus or another? And if the answer is nothing, then why would I want to know? And in medicine, the challenge is that knowing, or the process of finding out, can be dangerous. If I do a full body MRI and I find some sort of tumor or something that looks like a tumor, I can't just ignore it. I can't say, it's probably a false positive, no big deal, maybe your body will take care of it. You can't do those things. You basically are stuck doing a biopsy, doing further testing, and so on and so forth. It's not uncommon in medicine where the best option is to not know, not to do any further testing. Now take something simple, or people consider simple, like blood work. Actually, we had a really interesting case in residency where a lady came in for routine blood work, had some mild abnormality that led to other blood work, that led to other blood work, that led to a CT scan and then a biopsy. And the biopsy, unfortunately, hit a blood vessel, and this lady ended up dying. The biopsy came back negative. There was no cancer. There was nothing. The lab abnormality had gone back to normal. It was just a fluke, just a temporary abnormality. And this lady died from basically routine lab work. And even if it's a very, very rare case. That's a 1 in a million type case. But it just highlights the notion that chasing information can in itself be dangerous. And the reason we chase information, like this study shows, is because we do not have the internal fortitude to face uncertainty. And that is really what we need to learn, rather than chasing certainty, or in many cases, false certainty, like all these gurus that have this epigenetic biological age bullshit test. Rather than chasing false certainty, we need to face our own challenge of dealing with uncertainty. And it's a very common thing. Maybe that's the thing that this study shows, is that so many people are willing to trade physical pain rather than enduring the pain of uncertainty. And that notion just highlights how painful that uncertainty is and highlights how many of us have some work to do on our character. We need to build ourselves up into the types of people that can face uncertainty, because life has a tremendous amount of uncertainty. And when we do not have the inner fortitude to face that uncertainty, we may fall prey to scam artists like Prenuvo offering these full-body MRIs, or charlatans like Andrew Huberman offering certainty. Go stare at the sun for 90 minutes, take these supplements. There's no real science on it at all, but what he's offering us is not really a scientifically validated proof of what will help us live longer or feel better. What he's offering us is the illusion of certainty. What he's addressing is not the pain of suffering, not the pain of our mortality, but the pain of our uncertainty. So this is just such an interesting study because it really does highlight the notion that uncertainty is truly painful to us and highlights an area of growth where most of us have some room to improve.